Anxiety and stress are two of the most common mental health issues affecting people today, and they can be incredibly debilitating. Hello viewers, and welcome to our video on coping with anxiety and stress. If you're someone who struggles with these feelings on a regular basis, you're not alone. In this video, we'll explore some of the most effective coping strategies for anxiety and stress. So, let's dive into the video. And don't forget to hit the like button and subscribe the channel. What is anxiety and stress? Anxiety is a natural response to stress and can be defined as feelings of worry, fear, or unease. It's our body's way of responding to perceived threats, whether they are real or imagined. Stress, on the other hand, refers to the physical and emotional tension that we experience in response to external pressures. While anxiety and stress are different things, they often go hand in hand. For example, if you have a big presentation at work coming up, you might start feeling anxious about how it will go. There are many different types of anxiety disorders, including generalized anxiety disorder, panic disorder, phobias, and social anxiety disorder. Each type has its own specific symptoms and treatment options. Similarly, there are different kinds of stress: acute stress, chronic stress, and traumatic stress. Understanding these differences can help you better manage your emotions when faced with challenging situations. The different types of anxiety and stress. Anxiety and stress are two interrelated conditions that can have a significant impact on one's life. But did you know there are different types of anxiety and stress? Firstly, generalized anxiety disorder (GAD) is characterized by excessive worry about everyday events or activities, even when there is little reason to be concerned. Panic disorder, on the other hand, involves sudden and unexpected attacks of fear that trigger physical symptoms such as heart palpitations and shortness of breath. Social anxiety disorder causes an intense fear of social situations where people may judge or criticize oneself. Post-traumatic stress disorder develops after witnessing or experiencing a traumatic event such as war, natural disasters, or abuse. Obsessive-compulsive disorder creates intrusive thoughts which result in compulsive behaviors like repetitive checking or cleaning habits. Acute stress disorder occurs after a traumatic event but typically resolves within 3 days to 4 weeks. Symptoms of anxiety and stress. Symptoms of anxiety and stress can manifest in various ways, both physically and mentally. One of the most common symptoms is a feeling of unease or worry that persists regardless of the situation. This may be accompanied by physical sensations such as trembling, sweating, and dizziness. Another symptom that often accompanies anxiety and stress is difficulty concentrating or focusing on tasks. People with anxiety may find it difficult to complete their work or even perform simple tasks due to racing thoughts or feelings of overwhelm. Physical symptoms such as headaches, muscle tension, and stomach problems are also common in individuals experiencing high levels of stress and anxiety. These bodily responses are a result of the body's natural fight or flight response kicking into overdrive when faced with perceived threats. Additionally, people with anxiety disorders often experience sleep disturbance such as insomnia or restless sleep patterns. They may wake up frequently during the night or have difficulty falling asleep due to persistent worrying thoughts. Seeking professional help from a mental health provider can provide effective treatment options to manage these symptoms effectively. Causes of anxiety and stress. There are various factors that contribute to the development of anxiety and stress. One of them is genetics, as some people may inherit genes that make them more susceptible to these conditions. Another factor is environmental stressors, such as traumatic events or chronic exposure to stressful situations like work pressure or financial difficulties. Additionally, personal relationships and social support can also play a role in causing anxiety and stress. Other causes include medical conditions like thyroid disorders or heart disease, which can lead to symptoms associated with anxiety and stress. Substance abuse can also trigger these feelings, especially when drugs are used for coping purposes. Certain personality traits like perfectionism or being highly sensitive may increase the risk of developing anxiety and stress. Treatments for anxiety and stress. When it comes to treating anxiety and stress, there are a variety of options available. The most common treatment approach involves therapy and medication. Cognitive behavioral therapy is a type of talk therapy that focuses on changing patterns of negative thinking and behavior. It can be very effective in managing symptoms of anxiety and stress. Other types of therapy, such as exposure therapy or psychodynamic therapy, may also be helpful depending on the individual's needs. In addition to therapy, medication can also be used to treat anxiety and stress. Antidepressants like selective serotonin reuptake inhibitors or benzodiazepines may be prescribed by a healthcare professional to help manage symptoms. Prevention of anxiety and stress. Preventing anxiety and stress is essential for maintaining good mental health. Here are some strategies that can help to prevent anxiety and stress. Firstly, it's important to identify the triggers of your anxiety or stress. These may be certain situations or people that cause you to feel anxious or stressed out. Secondly, practicing mindfulness techniques such as meditation, deep breathing exercises, and yoga can be effective in reducing stress levels. Thirdly, making time for regular physical exercise is essential for preventing stress and anxiety. Exercise releases endorphins, which promote feelings of well-being while also decreasing the levels of cortisol in our bodies. Fourthly, getting enough sleep every night is crucial in managing mental health issues. Talking about your problems with someone you trust, whether it's a friend or a professional therapist. Conclusion: in today's fast-paced world, it is common for people to experience anxiety and stress. While a certain level of anxiety and stress can be normal, too much of it can negatively impact our mental health and overall well-being. The causes of anxiety and stress can also differ among individuals. However, some common triggers include work-related pressure, financial difficulties, or personal relationships issues. Fortunately, there are several treatments available for managing anxiety and stress. These range from therapy sessions with a counselor to medication prescribed by a healthcare professional. Thank you for watching our video on coping with anxiety and stress. We hope that you found the information and strategies helpful. Don't forget to hit the like button and subscribe my channel. And also share it with your friends and family. We will be back soon with a new video. Till then, keep supporting and take care.